It's a busy afternoon on the grenade practice range.
Prepare to throw. Throw. Station number 3, take grenade.
The men are throwing live grenades for the first time.
Throw. Station number 4, take grenade.
Everything is going along smoothly when
Pull pin.
something goes wrong.
Prepare to throw. Throw.
Far away in the bleak and desolate north, an experienced soldier is doing sentry duty. Suddenly, he's overcome by a wave of depression. At an Army training camp, Private X is on sick call for the 4th time in a week. His back hurts and he can't straighten up, but the medical officer has found nothing physically wrong with him. Overseas, a young officer is lost in some little town. He doesn't know how he got there or even what his name is. This soldier has been keeping to himself and acting strangely towards the other men. He thinks they're whispering about him. Then, in the middle of chow, he thinks the milk tastes funny and accuses his neighbor of trying to poison him. At a medical aid station, combat casualties wait to be treated. A jittery soldier, exhausted by combat experience, reacts to an unexpected noise. These men are all suffering from some form of psychiatric disturbance. There's nothing strange or mysterious about that. Nervous, emotional, or mental illness can occur in anybody. The seeds are in all of us, just as are the seeds of physical illness. Take any cross-section of the United States Army, a tough and rugged body of men, but not a single one of them is 100% healthy. Some have a little sinus trouble. Some have periodic attacks of boils. Others have had repeated attacks of appendicitis, which may return in an acute form. More than half have been slightly infected with tuberculosis without even knowing it. But the scars of the old infection remain. Not one man in 100 has a perfect set of teeth. And each man's body carries millions of germs ready to attack should he be weakened by exposure or fatigue. Even the healthiest people aren't pure white healthy, or the sickest people solid black sick unless they're dead. Instead, people are somewhere in between, neither white nor black, but some shade of gray. Most people are light gray, a lot of health mixed with a little sickness. It's the same with emotional or mental health. Slight mental or personality disturbances are present in everybody. No one is 100% perfect. Private Phillips worries too much, whether about a mortgage or a letter 2 days overdue. Green, without cause, feels that he isn't up to the standard of the rest of the outfit. Davis is quick-tempered, aggressive on the surface, but really oversensitive. He can't take orders or kidding. Becker has trouble making decisions. Parker feels he's always getting the dirty end of things. These tendencies, if magnified, can seriously impair the men's ability to function. No man is without some little fear or tension, some nervousness or uncertainty. Nobody has perfect, pure white mental health. Most of them are some shade of light gray. And these men are merely darker shades of gray. In them, the balance between emotional health and illness has been tipped toward the unfavorable side. The foundations of physical and mental health are laid in infancy. A child is born with its lungs and digestive tract free of germs, but as it starts life in the outside world, it admits thousands of them. The newborn baby has very little permanent immunity or resistance to disease, but in fighting and conquering infection, resistance is developed and strengthened. An important phase of the building of physical health has begun. It's the same with mental health. Beginnings are made by tackling and overcoming small difficulties, such as learning to sit up. Little Bill Brown's wise and understanding mother gives him a sense of security, without which these first attempts cannot be made. Even here, she allows the child to develop self-reliance. As the problems get tougher, his ability to deal with them increases. Bill Brown is now 2 years old. He begins to meet small frustrations and deprivations. But having already built up a reserve of inner strength and security, he's able to handle his disappointments without too much trouble. Bill Brown runs into aggression and learns to resist it. He learns cooperation and teamwork. He competes with others and develops self-confidence. A wholesome and stable family relationship strengthens his sense of security. His natural striving to find an important place for himself moves in a useful and constructive direction. He develops healthy attitudes toward responsibility and authority. As he learns to do things for himself, he loses the helpless feeling he had as a baby. He still needs his mother's love, but it's beginning to develop into a give and take relationship between two people. Bill Brown has acquired a sound foundation of emotional and mental health. The outlines of his personality are already pretty well set. When he grows up, he won't remember the details of his early experiences, but deep down in something we call the unconscious mind, they will be preserved, and they will influence his actions throughout the rest of his life. But not every child gets off to such a good start. Joe Smith has a mother who is over-anxious, afraid to let him expose himself to the smallest danger. As a result, instead of getting over his early fears, he tends to hold on to them and exaggerate them. Joey might pick up a runny nose, so he's deprived of the chance to learn how to get along with others. He lacks inner security and is defenseless against aggression. A toy taken away from him becomes a tragic crisis. His mother's consolation merely increases his dependence upon her. By now, his timidity and fear of getting hurt have become fixed. The ridicule of his playmates only makes matters worse. Joe Smith grows up into an oversensitive young man who makes few, if any, friends, doesn't go out with girls, and generally keeps to himself. He is almost completely dependent upon his small family circle for all human contacts. Of course, this needn't prevent Joe from being a good student. After graduation, he may even get along quite well if he's lucky enough to get a job where he can avoid too much contact with strangers and where the strains and stresses are reduced to a minimum. But nonetheless, Joe Smith is a borderline case in terms of emotional stability. His mental health is a fairly deep shade of gray. In our society, Joe Smith is by no means a rarity. Today, the medical profession's greatest problem is the large number of personality disorders. In private practice, 50 to 75% of all patients suffer from some degree of nervous, emotional, or mental disturbance. Frequently, physical symptoms are an expression of deep-seated emotional troubles. Of hundreds of thousands of hospital beds in the United States, more than half are occupied by patients with serious mental illnesses. Medical statistics indicate that in the United States, out of a total population of more than 139 million, 1 out of every 18 people, or more than 7.5 million, will at some time be treated in a mental hospital. A far greater number will suffer from less serious emotional illnesses. From this population, the American people, the personnel of the Army is selected. Some people may think that the neuropsychiatric problem of the Army can be solved at the induction stage by thorough screening. But to eliminate all potential breakdowns, it would be necessary to reject everyone with any trace of emotional or mental illness, and there would be no Army at all. Therefore, the medical department, using individual psychiatric interviews, eliminates only those who have little chance of withstanding the strains of Army life, those who are already casualties of civilian life. In World War II, the number rejected came to 14 out of every 100 men called up. It's impossible at the induction stage to predict which of those who remain will become casualties of the new stresses of Army life, for these stresses will vary widely in kind and degree for each man, depending upon assignment and other environmental factors. A man of light gray mental health who is subjected to great stress may become ineffective in a short time. A man of darker shade who encounters milder stress may be able to stand the strain much longer. Each man's resistance to stress is strongly affected by other unpredictable factors, such as the kind of leadership he gets. Good leadership raises efficiency. Bad leadership lowers it. It also depends on the incentive or desire to carry on. The stresses of Army life commence immediately upon induction. The recruit is yanked out of his civilian environment and plunged into a routine where individual freedom is replaced by regimentation. And privacy is thrown out of the window. A man isn't even alone when he goes to sleep. Gone are the comforts that help to counteract the strains and stresses of living. Gone is the daily homecoming and all that it means. Any way you look at it, digging a trench is hard work. But for a man like Joe Smith, whose energies are already depleted by emotional tension, uncertainty, and worry, it's twice as hard. Joe is sweating it out, but he's a fish out of water, and the strain is beginning to tell. The obstacle course is a nightmare to him. As in childhood, he's still afraid to jump. He loses his appetite. He sleeps poorly. Finally, Joe Smith cracks. He is undergoing an anxiety reaction, the most common form of psychoneurosis. The sentry has a depression form of psychoneurosis, in which the loneliness of the environment has been one of the crucial factors. The soldier with the back trouble has a conversion reaction. His emotional disturbances and anxiety have been converted into bodily symptoms that are as real to him as though they actually had a physical basis. Sometimes an inner emotional conflict becomes too painful to bear, and a sudden loss of memory or amnesia occurs. This may bring a decrease in suffering to the patient, but at the cost of his normal functioning. All of these cases are forms of psychoneurosis. But this patient has a mental illness of an entirely different kind. Suffering from delusions of persecution, he has what is called a psychosis. While in the acute phase, he is regarded as insane. This condition, psychosis, must not be confused with psychoneurosis. Psychoneurosis is not insanity. In dealing with any major health problem, the first step must be preventive, aimed at lightening the average shade of gray of our Army personnel. High morale is most important in this connection. It can be fostered by developing basic morale-building attitudes, belief in the justice of our cause, confidence in weapons and training, recognition of personal ability, pride in the unit, and confidence in leaders. To build morale is a function of command. Morale is the first essential of preventive psychiatry. As an important morale factor, the medical corps aids the soldier in making the mental adjustment to Army life.
All right. What about this thing, fear? Your heart starts pounding, you breathe faster, you're tense all over, but at the same time, your hearing and sight become sharper. So fear isn't entirely a bad thing. Actually, it's nature's way of getting you alerted in the face of danger, so that your body is ready to act in a split second. Now, everyone feels some fear.
A similar program for officers supplies basic information on psychiatric questions.
But there are quite a few men with minor psychiatric disturbances who, with the proper help at the right time, will make the grade and become efficient soldiers. Therefore, it's important for all of you to know some of the outstanding symptoms of nervous or emotional illness, so that if a man is having trouble, he can get treatment early. Now, suppose a quiet, mild-mannered
Yes,
soldier
in every case, early treatment is essential before the condition becomes more severe and much harder to cure. Take Joe Smith. His commanding officer knows that his symptoms are not mere indications of momentary fright. He's been watching Joe for some time and realizes that he may be sick. He's satisfied that Joe requires medical help and makes an appointment for him at the mental hygiene clinic. Here, the preliminary work on Joe's case is handled by Army psychologists and social workers. Then, Joe is interviewed by the psychiatrist in charge.
Well, Joe, from what you told me, it looks as though you never really had a chance to grow up and develop. You always had to depend on your mother and father for reassurance. Now tell me, what happened on other occasions when you've been away from home?
First time I've been away, sir.
Never before? Not even for a weekend or even overnight?
Well, except for the time
Yes.
a couple of years ago the company transferred me to St. Louis.
What's the story on that, Joe?
As soon as I got there, in fact, even before on the train, began to feel lonely, blue. I was all alone. I got to feeling so jittery.
Did you have crying spells then, too?
Yes, sir. I felt so bad. There seemed no reason for living.
You thought of doing something to yourself?
Yes, sir. I even looked out of the window. We were on the 12th floor. I thought maybe I might go out.
What happened after that?
Just quit and came back home.
Though Joe Smith doesn't realize it, he is receiving his first psychiatric treatment. Already, the doctor is helping him to see himself more clearly and to understand his deep feelings of fear and inadequacy. Joe learns that his case is not hopeless and that there is a real chance that he can change.
Well, Joe, what's happened to you isn't strange or unusual. I've talked to lots of men with the same kind of trouble. But how is it you didn't mention any of this in your interview at the induction center?
I wanted to be in the Army, sir. I hate being like this. I want to be as good as all the other fellas. But look at me. I'm no good to myself or anybody else.
But Joe Smith is better than he thinks, and the doctor tells him so. Joe wants to help himself, and that's half the battle. The psychiatrist arranges a talk with Joe's company commander. He explains to him that although Joe isn't cut out to be a combat soldier, he may still be of real value to the Army in an environment more suited to his personality. Joe was reclassified to limited service as a company clerk, where he was able to use his skill as a stenographer and secretary. During many months of excellent service, Joe was promoted in rank and carried out a useful and important assignment in battalion headquarters. During this period, Joe saw the psychiatrist from time to time. And then one day,
what I'd like to do is to get a transfer to some other post and start there from scratch.
Do you really feel that you're ready to leave this place, Joe, and go somewhere where you don't know anyone? Where you haven't any friends?
Well, sir, I want to prove to myself that I can get along okay on my own. I think I can do it.
Joe Smith's mental health actually improved in the Army. He developed an independence and maturity that he had never known in civilian life. But if his case had been handled badly, he would have become worse, with the eventual outcome, hospitalization and discharge. The depressed sentry, too, showed marked improvement after transfer from his isolated post to duty as a weapons instructor. Again, appropriate environmental change in itself helped the patient to overcome his personality disturbance and to continue his service to the Army. But many more stubborn cases require hospitalization, some only for a short time, others for longer periods. Some men have to be separated from the service. Among these are the more severe psychoneurotics and the psychotics. The men who finally go into battle are the cream of our young manhood. The weak have been eliminated. Those who remain have stood the test of months of strenuous training. Their average shades of gray, both physical and mental, are very light. Then the battle begins. As the fighting progresses, the number of neuropsychiatric breakdowns is multiplied many times. Remember young Bill Brown? You saw his mother tuck him into bed and kiss him goodnight when he was a little boy. He's become a BAR man in the rifle company, a tough, well-trained, experienced soldier. But he's been in combat for a solid year and pinned down by enemy fire for the past 3 days. He's had about 4 hours sleep out of 72, and he's down to his last few rounds of ammunition. How long can he last without cracking? Perhaps indefinitely. Perhaps for only a few minutes more. Even the toughest man may reach the breaking point. For in combat, emotional and physical stresses are enormously increased. The inner conflict between the soldier's pride, sense of duty and loyalty, his instinct of self-preservation, his natural fear of death and mutilation is greatly intensified. Add to this the weakening effect of physical exhaustion, and the setup is ideal for psychiatric breakdown. Yes, even such a healthy specimen as Bill Brown can be brought to the breaking point by the strain and tension of prolonged combat duty. For Bill Brown is a combat casualty, just as much as though he had been wounded by bullets or shell fragments. His is merely a different type of wound, requiring immediate and specialized treatment. Bill Brown is returned to a medical installation near the front lines for screening and treatment. One out of 5 combat casualties in World War II was a psychiatric case. At the clearing station, interviews with a division psychiatrist will determine the best treatment and disposition of Bill's case.
Well, soldier, you've had it pretty tough. How did you feel up there?
I don't know. All mixed up in my head. I just sort of lost control.
You say you've never been like this before?
Never before.
Smoke?
Bill Brown's anxiety reaction is fairly severe and is characterized by tremor and manifestations of panic.
Take it easy. You're all right. You don't have to worry now. You're safe here. You get something to make you sleep tonight. Then tomorrow you'll go back to another hospital for a while and get a good rest. Kelly?
Yes, sir?
Bill Brown has had it tough, but with time and care, his basically sound personality will reassert itself. In a second case, the anxiety symptoms are milder.
Tell me, soldier, what's your trouble?
Well, sir, up on the line, we got into pretty heavy shelling. A couple of my men were killed. Then another shell came in, broke my rifle. Picked me up and threw me off a ways.
Yes. Go ahead.
I guess I ran. Must have. To get 150 yards ahead of the company.
Then what happened?
When I came to, the lieutenant was shaking me. I was crying. Don't remember much after that.
How do you feel now?
Shaky inside now.
What do you mean?
I can't exactly explain it. Feel it more inside than I do outside. A kind of boiling feeling.
How long have you been in combat?
9 months now, sir.
Have you been wounded?
Once.
How did you feel after you were wounded?
Before I was wounded, I wasn't jumpy. After that, I was very jumpy. Guess I haven't got it anymore. The way I used to.
You've had a common experience. Nothing to worry about. Your nerves are on edge. You're frightened. We'll see that you get a chance to clean up, get some hot chow, and rest.
Here, reassurance is essential. The patient must understand that his case is not unusual and that it is nothing to be ashamed of. He's told that he will recover soon and completely.
That's all.
Thank you, sir.
In the division area, the patient rests and relaxes under the supervision of experienced medical personnel. Here, sleep and plentiful regular meals exercise their beneficial effect. Relaxation and a return to normal social relationships promote a general sense of well-being. After a few days, the patient is interviewed again.
Let's see. You've been here 3 days now. How do you feel?
Pretty good. I've calmed down a little bit, feel a little bit better. I had a fairly good sleep last night.
Have any medicine to make you sleep?
No, sir.
Slept well without it?
Yes, sir.
How do you feel about going back to your unit again? Think you could do a job?
Well, sir, I think I can.
Good. You'll be ready for that in 4 or 5 days. I'm sending you to our retraining unit. You'll get some marches, exercise, and work out with your equipment. Sound okay?
Yes, sir.
What you've had was like a safety valve, a way of letting off steam. Everybody has it. Anything else?
No, sir.
Those patients that show a speedy and definite improvement are moved to an adjacent area. Here they receive a short course of exercise and combat training. Then they're ready to rejoin their units in the field. About 40% of all combat neuropsychiatric casualties were returned to full duty after short-term treatment near the front lines. But what of the remaining patients who are more seriously sick? The further disposition of these cases is decided by the examining psychiatrist.
What's your trouble? Go ahead, you can tell me.
Can't stand seeing people getting killed.
I can't hear you.
Can't stand seeing people killed.
Where did you see people killed?
On front.
What happened up there?
Men on forward slope. Germans started shelling. We were trapped, couldn't get out.
Go on, what happened?
I was lucky. I hit under the bridge. Started shelling again. I went crazy. Started running.
How do you feel about that? Leaving your buddies?
Should be in stockade.
How do you feel right now?
All right. Nothing wrong with me.
What were you afraid of?
Everything.
What in particular? What in particular?
Dead.
Dead what?
Dead people.
I can't hear you.
Can't stand seeing dead people.
What does that do to you?
Scares me.
Well, dead people can't hurt you.
But I've been telling myself for years that I can't stand to look at it.
Corporal, I'm going to send you back to another hospital where you can get some rest and treatment. In a couple of days, you'll begin feeling better. How does that sound to you?
Anything but going back up there.
Now, look, you're going to be all right. When you get back
In
to the
addition
other
to
hospital.
severe anxiety, the patient is deeply depressed. His speech and reactions are retarded, and he has a characteristic feeling of guilt. He will require more extensive observation and treatment in a psychiatric installation farther behind the fighting front.
Just can't take...
Often, a seasoned soldier reaches the breaking point after many months of duty.
What happened?
Well, I've been going quite a long time.
without any trouble. But now the shelling gets me.
How long have you been in the Army?
34 months.
How much combat?
I went through Africa, Baltuno, Anzio, up to there.
Ever lose any combat time?
No, sir.
You've had about 320 days then.
Yes, sir.
How long have you been a staff sergeant?
Think about 4 months.
Have you done a good job at it?
Yes, sir. Until now. I'm no good now.
What do you think's wrong with you now?
Sir, I feel I've gone about as far as I can go. Feel I've taken about enough.
Do you think you're sick?
No, sir, but just no good anymore. Can't stand shelling. Last time up there, broke down.
What do you mean, broke down?
Didn't know which way to turn.
Ever have this trouble before?
No, sir.
How do you feel about leaving your men?
Well, I feel pretty bad about it. But I'm no good to them anymore. I can't lead them. I might get them killed or get them wounded. Just no good.
This is a typical example of chronic anxiety, sometimes called the old sergeant syndrome. Along with other severe casualties, he is sent to installations in the Army zone where additional facilities are available for prolonged psychiatric treatment. In the Army zone, a larger staff of psychiatrists is maintained to afford individual attention to each patient. The veteran sergeant is again interviewed.
I've been overseas about 30 months.
Just how did the shells affect you, Sergeant?
Well, they affected me pretty bad. It seems I've gone as far as I can and cracked up.
Well, how do you feel now?
As long as I'm not under fire, okay.
Sergeant, how do you think you'd work out on another job? Say a depot. Can you do that?
I think so, sir.
Reassignment is necessary for many of these cases. However, return to combat is often possible after further treatment. Here is Bill Brown after 3 weeks.
Well, you've come around nicely, Bill. I thought you would.
Well, I didn't. Oh, not for a time, anyway.
By the way, you ever hear from any of the men in your old outfit?
Well, no mail. But, well, a couple of the fellas did stop in to see me.
Bill, how was it seeing those fellas again? Did it make you feel that you wanted to get back with them?
It's a tough question. Well, you know, after what happened, I really don't want to go back. But, well, I think it's what I ought to do.
You feel you'd be all right on full duty?
Took a lot to knock me out the first time. I guess I'll do as well as the next man.
Bill Brown's recovery is not unusual, although the number of cases returned to combat decreases sharply as treatment is more removed from the front lines. But more severe cases require intensive forms of therapy.
Just relax. Take it easy and do what I tell you.
Here is an amnesia case who has forgotten everything that happened since he was blown out of his foxhole.
This won't hurt you. Count slowly now.
1, 2, 3.
The injection of a sedative allows the patient to relive his battle experiences and, with the doctor's
32,
help,
go on.
face them again.
33. 34. 34.
Now, Alan, you're on the battlefield. The shells are coming in. What's that shell? Duck!
Get in the hole. Shells are bursting all around.
Where are you? Where are you?
In the hole. My buddy's dead.
What happens now?
Take the ridge. You'll lose a lot of men in the company. The Germans surrendered. They throw their guns away, ask for cigarettes. They want to look at our knives, say, comrades. Comrades, hell. They shoot my best buddy. Watch the shells. Get me out of here. Tom. Tom.
I'm here. What happened after you captured the ridge?
Will I have to go back there again?
You'll be all right. You're safe now. Safe now. Wake up. Wake up now. You were in a lot of trouble. You're better now. Shells didn't hurt you.
This
You're in a
treatment,
hospital.
when employed
Nothing to
early,
be afraid
reduces the danger of chronic neurosis. Although not a magic cure-all, it often produces dramatic results with the acute neuroses resulting from the stress of battle.
Let's see, Corporal.
The retarded patient in later interviews is still depressed and anxious, but his depression and feelings of guilt have lifted enough so that he is better able to respond to the interviewer.
What sort of a person were you as a child?
Wasn't sick much. Had a inferiority complex, pretty bad.
Just what do you mean?
Well, when I was a child, I didn't think I was as good as anybody else.
Play with other children?
Oh, no, sir, I was the trouble. I didn't make any friends.
How did you react as a child to dead people?
Oh, I couldn't look at them.
How did they make you feel?
I couldn't stand anything bad.
Did you ever get into a fight?
Oh, no, sir, I never cared for fights. I saw a man killed once in a street fight. Head hit the curb. He just lay there. They covered him up. Oh, I was scared. I was scared to tell my parents. I had nightmares about it for years.
How old were you then?
I was about 6.
Did anything like that ever happen again?
Not till I got into combat.
What do you think is wrong with you?
Oh, I don't know, sir. Everything seems kind of hopeless.
Well, it's not as bad as you think. I've seen a lot of people with the same thing. It'll take time, but you're going to be all right.
This patient will need extended treatment at a hospital in the communication zone, or if necessary, in the zone of interior. Thus, he completes the chain of evacuation which started in the combat area. From the front lines, the neuropsychiatric casualties were sent to nearby clearing stations for screening and treatment. Here, approximately 40% of all neuropsychiatric casualties were returned to full duty. The remaining patients were evacuated to Army installations where intensive treatment salvaged an additional 20%. A large number were reassigned to limited service. More serious cases were then sent back to the communication zone level. At this level, only 1 to 2% were returned to combat. Patients reassigned bring the total from base and Army level to nearly 30%. Approximately 10% of the original neuropsychiatric patients are evacuated to the continental United States. This system of neuropsychiatric treatment afforded early and intensive care. It returned a large proportion of soldiers to combat and salvaged many for useful reassignment. But for the more serious cases, the next step is evacuation and the long voyage home. Back home, the patients that don't need hospital care are sent to convalescent hospitals, where both combat and non-combat cases lead a normal barracks life under the supervision of specially trained personnel. The battalion commanders are medical officers. Severe cases, both combat and non-combat, are treated at the general hospitals, some of which are devoted exclusively to the care of neuropsychiatric patients. Here, all techniques of psychotherapy are employed. Individual psychotherapy, the personal contact between patient and psychiatrist, is the basic element of all treatment.
Well, you're coming along nicely, Corporal. I want you to stay in the hospital for a while longer, though. I want to be sure that you're in really good shape before you leave.
Okay, sir. I sure do feel better than when I first got here. And I want to get back.
Explanation and reassurance based upon an understanding of each individual's emotional conflict contribute fundamentally to the patient's recovery. Sometimes an emotional disturbance shows itself as a physical ailment. Here, an inner emotional distress has been converted into a form of paralysis. In this type of case, treatment under narcosis may yield extraordinary results. Here again, a sedative is employed. Under the influence of the drug, the patient's mind becomes more open and receptive. While the patient is in this highly approachable state, the doctor employs the power of suggestion to pave the road toward recovery.
Now you're going to get right up and walk. Come on now, sit up. Now get off the bed. Put your feet right down on the floor. That's fine. All right, now stand up. Isn't that good? All right, now walk out there. Walk right over to the ward man all by yourself. Go ahead, you're doing fine. All right, now turn around and come back to me. Come on now. Now I'm going to let you go back to sleep, and when you wake up, you're going to keep right on walking. How about it?
Thanks a lot, Doc.
Righto.
A technique which is basically similar, hypnosis, is effective in treatment of amnesia. This man doesn't even remember his own name. A shell burst in Okinawa wiped out his memory. The experience was unendurable to his conscious mind, which rejected it, and along with it, his entire past. But the unconscious memories remain. Through hypnotic suggestion, the psychiatrist will attempt to uncover them.
You can remember everything. You can remember everything. You're back in Okinawa. Tell me what you see. Tell me. Speak.
In the battery area.
You're in the battery area. Go on. Tell me what's going on.
Jap artillery. Getting our position.
Jap's getting your position. Go on.
One of the boys got hurt. They're taking it away.
Yes, yes. Go on.
Running to my gun position.
Yes, you can remember it now. Tell me. It's all right now. You can tell me. You can tell me.
Explosion.
Yes, you remember an explosion now. Go on.
They're carrying me across the field.
Across the field. Go on.
They're putting me on a stretcher.
Yes, yes. All right. Go on.
They're still throwing shells.
Go on. You can see everything clearly now.
I'm in a truck.
Why are you fearful now?
Don't want any more.
You don't want any more.
No.
You want to forget it, but you're going to remember it because it's gone now. It's gone. You're back here now. You're away from Okinawa. You have forgotten it, but you remember who you are now. Who are you?
Bates.
Bates. That's right. Full name now.
Donald Bates.
Donald Bates. That's right. Now your mother's name.
Margaret.
Father's name.
Thomas.
That's fine. You know who they all are now. All right. You're coming back with us now. But this is going to stay with you. You're going to remember it all. You're going to remember about Okinawa. You're going to remember about the shells and the bombs out there. But they won't hurt you now. You're at ease and relaxed. No fear, no anxiety. When I wake you, you'll be comfortable and relaxed. No aches, no pains, but you'll remember everything I've told you. All that you've remembered.
Under the guidance of the psychiatrist, he is able to regard his experience in its true perspective as a thing of the past which no longer threatens his safety.
You can wake now. Well, how are you?
Pretty good.
Now he can remember. At the General Hospital, all facilities are available for the most advanced treatment. Electroshock therapy is remarkably effective with certain acute psychoses. The continuous tub treatment is also an effective method of sedation for severely disturbed cases. The patient relaxes under constant observation in a scientifically regulated bath. The wet pack treatment has a similar soothing effect. Individual treatment is supplemented by group activities. Particularly important is group psychotherapy.
Let's think of it a little bit like this. We want to get you out of your feeling of isolation. Therefore, it is important that you learn to understand something of the basic cause of your distress. That you learn to understand.
The patients are given some information as to the cause of their condition and under skilled direction discuss their difficulties, helping each other to overcome the false sense of shame that often accompanies mental and nervous disorders.
Your inner conflicts are, with variations, common to all men. Many of these conflicts start way back in early childhood. No doubt you men will find it easy to recall things that disturbed your feeling of security in childhood. Fears, hatreds, jealousies, and so on. Let's see if you can give some illustrations of this kind.
If I did anything wrong that I was ashamed of, I was always ashamed to go and tell my parents what I'd done.
Well, that's about how I felt, too. I kept it to myself if I did anything wrong, and I know I used to be in a constant fear that my parents would find out what I was doing.
Well, you both did about the same thing. In other words, you both used the same method to get relief from anxiety.
In the occupational therapy shop, art and craft work establish a new confidence through the satisfaction of a job well done. Some patients try their hands at specialized vocational skills in which future employment offers a strong incentive. Supervised exercise affords a feeling of health and physical well-being. The give and take of competitive sports rebuilds confidence in badly shaken personalities. As a cooperative member of a group, the patient soon begins to feel at home again. Entertainment and social activities are vital steps in the patient's readjustment to normalcy. And throughout, there is the continued individualized contact between doctor and patient.
Oh, hello there. Come in. I was hoping you'd drop in. Sit down.
Thank you, sir.
I hear you're going to leave today.
That's right. I just stopped by to see you before it was time to go.
Good. I'm glad you did. How are you feeling? Glad to get away?
Well, you know how it is. I've been waiting for this for a long time. This is a pretty big day in my life.
Of course it is. I hate to see my prized patients leaving, but what can I do? Well, goodbye, and best of luck to you.
So long, Captain. And thanks.
Summary and discharge note on...
The patient leaving the hospital after long treatment is an end product of the Army's neuropsychiatric program. This program deals with complex and difficult problems, which have their beginning where the Army begins, in the induction center. At this early stage, the first preventive step is taken to protect the individual as well as the Army. Careful screening assures that only the healthiest of our civilians enter the service. The preventive approach is implemented by an educational program in mental hygiene. Emphasis is placed on those facts which build and sustain the morale of Army personnel. When psychiatric breakdowns threaten or do occur, understanding and cooperation, plus immediate recognition of early symptoms, followed by prompt treatment, promote a rapid return to health. Until proven otherwise, even the most serious cases are regarded as salvageable. All these elements combine to make the most of the human resources that are the backbone of any army. An army is no stronger than the population from which it is drawn. To keep America strong, we must strive to improve the physical and mental health of the whole nation through a deeper understanding of those factors which darken or lighten the all-important shades of gray.